and this time I'm talking to Professor Chris Fitzpatrick about the Lucy Letby case, the nurse who was convicted in the United Kingdom of multiple murders and attempted murders. So, can I ask you, Chris, when did you first become acquainted with the Lucy Letby story, and how did you find out and hear about it in the first place?
Well, the first I heard of the Lucy Letby case, Terence, was in relation to her arrest, which was back in November 2000. And then the trial started then by 2 years later, and there were obviously reporting restrictions on the trial. But I particularly remember the photographs of her that were portrayed in the newspapers around the time of her arrest. And then, I suppose most dramatically, then the outcome of the first trial, because there were two trials. She was found guilty of the murder of six babies and the seven babies in the attempted murder of six in August 2023. And then there was a subsequent trial later on in relation to one baby, and she was found guilty of the attempted murder of that baby. But the reporting around the time of her sentencing was very dramatic, and I particularly remember comments made in the House of Commons by Rishi Sunak, who said when she refused to actually attend for her subsequent sentencing that this was an act of cowardice. And also around the same time, Keir Starmer, who had been a former director of public prosecutions, made very critical comments in relation to the need to change the law so that a woman who committed such horrific crimes as these, a healthcare worker, a neonatal nurse, should in fact be brought to court to face her accusers, and in this case to face the bereaved families. So it was very dramatic. It was very intense. It was all over the broadsheets. It was all over the tabloids. And the image that kind of stuck in my mind was that facial image of her, that very close-up photograph, looking blankly into space, kind of her hair kind of down on either side of her, totally expressionless, and commentary such as kind of looking into the gates of hell, and a very similar photograph I remember from Myra Hindley, and so that was that was
She was
my
public enemy number one.
she was public enemy number one, and
She done a
uh,
very bad thing, and everyone felt that, like Joan of Arc, she should be punished and punished badly.
like it was a case of kind of unmitigated evil,
What did she
and
do? What did she do?
well,
What
well,
was
she
she?
was she was basically found guilty. There were 17 cases that were brought to court, and she was found guilty of having murdered seven, and also attempted to murder seven. And there were a variety of methodologies of how she committed the crimes. And I suppose, having worked in a maternity hospital for over 30 years, like the thought that a neonatal nurse could do something like this, the thought of a healthcare worker do anything like this was just kind of unconscionable. And like, she was one of four women ever who got a full life sentence for murder, like Rose West. And also Myra Hindley were two others. So she was in that category.
Who worked with men? Who also had a man involved?
Yes. Well,
But she was
anyway,
accused of doing this on her own. And
on her
I think
own.
unusually murderers, it's unusual for murderers to have different methodologies, isn't it? I mean, I don't know. I don't haven't studied the figures, but
Yes.
Jack the Ripper doesn't suddenly poison somebody and then push somebody else off a cliff. It's
Well,
one.
Well, there were a variety of methods that were actually brought forward by the prosecution, and in some cases they actually changed the method. So in three cases, actually the methodology was actually changed. So there,
What do
I
you mean the
suppose.
methodology
Well,
changed?
like
You mean
there were different reasons brought forward in terms of the use of injection of air into the blood circulation, injection of air into the stomach, and the chief prosecution witness, and I'll come back to maybe that person, because that person was, I suppose, key to the prosecution. Just shows, I suppose, the maybe the level of uncertainty that existed in relation to the narrative that was presented by the prosecution. But I suppose, going back into Lucy Letby, you said kind of that her varying methodology, according to the prosecution, is not maybe typical of a serial killer. And I'm not a criminologist either, but there was nothing in Lucy Letby's background prior to the accusation to suggest that she could be that anything like this could happen to her. Like, she was all the independent reports that have come through, and also reports of colleagues, etc., that she was a very well adjusted, very kind, committed, meticulous neonatal nurse who had taken extra qualifications in relation to her practice, and nothing to suggest her background, her family background, her social interactions, that she was capable of anything like this at all. So that kind of jars with the, I suppose, with the finding that she could be capable of something like this, that this suddenly emerged out of nowhere. And also there was no motivation whatsoever in her own psychology, in her background, that would have driven her in this direction. I suppose the thing that was lacking in the case, and it began to emerge slowly, and I remember that the first really strong feeling I got that this, in fact, might be a miscarriage of justice, that might have actually got this wrong, was an article that appeared in the New Yorker back in May 24, written by a journalist called Rachel Aviv, and she wrote a 13.
Shout out to them for the incredible work they did on that.
She wrote a 13,000 word article where this was actually published in the New Yorker, but it was actually around the time of the second trial, and there were reporting restrictions, so it wasn't available to readers in the UK. But she called into question a lot of the arguments that had been brought forward by the prosecution. And I can come back to those.
I saw that was when I came across the Lucy Letby case myself. And when I read that article through, what struck me was that I don't know enough about medicine to know if she was innocent or guilty, but I did think to myself, oh my God, the state hasn't proved their case here at all. They haven't proved that this woman is a killer at all. She may be a killer, she may be innocent, but they certainly haven't proved that she's done this. There's not enough evidence there. Where were the leaks of the evidence, Chris, that you immediately saw?
I suppose the issue was that, first of all, nobody saw her do anything. And in an intensive care unit, which is an area of intense observation, busy area, nobody witnessed her do anything whatsoever. Before we get into actually the nitty gritty of the case, there was a context to this which was not not made, so a jury would not have been aware of this. And it's a context that actually was happening at the time, and also, I suppose, more information coming to the fore in relation to the circumstances in which she worked, the hospital in which she worked. So I suppose the microcosm of her work was she was working in a hospital, which was the Countess of Chester Hospital, and this was a hospital which was a level 2 hospital, so it would look after babies from 27 weeks onwards. But for a period of time, this hospital had been taking, because of pressure in the system, pressure in the network of hospitals that they worked with, that they were taking referrals of babies that were actually at more immature gestations. Also, there were 7 paediatricians working in the hospital, of only which one of whom only had specialist training, a special interest training in neonatology, but none of them were subspecialist neonatologists. In other words...
Before we go any further, Chris, can you explain to me the significance of babies arriving into the hospital younger than 27 weeks and the significance of having only one neonatologist on the premises?
Well, small babies are not just small children. Like, they have a very different physiology. They have a very complex physiology. And to provide optimum care for babies this small, this fragile, this vulnerable, you need to have people who are specialized in that area, who are not actually dealing with kind of older children, who are actually focusing their attention, and their training has been particularly directed of children that are kind of like down to 1 pound and smaller. So that when that is absent, when that is absent, it is quite likely that people are actually practicing out of their depth or out of their comfort zone. So this hospital was taking referrals due to pressure in the system of babies that were of lower gestation. The second thing was that they didn't have a very experienced registrar. So the next tier of doctors in the hospital, not very experienced in terms of neonatal medicine. Lower than that, at SHO level, they had no career neonatal or pediatric SHOs. There were GP trainees who were actually in doing a rotation. And Lucy Letby was kind of 3 years qualified when these cases began to emerge. And she was considered to be one of the most qualified nurses in the unit, and would volunteer for extra shifts, because of her extra qualifications, was present at many of the crises that actually happened in the hospital. And in most professional medical backgrounds, 3 years post-university doesn't actually qualify you as being kind of very experienced at all. So 3 years a doctor, 3 years a solicitor, etc., you're not considered. So the context of this hospital was that it was kind of stretched, probably flying by the seat of its pants. And this was borne out by, I suppose, kind of an inspection that happened. So when there was a spike in deaths, they called in the Royal College of Paediatrics and Child Health. That was in 2016, during a spike of neonatal deaths in the unit. And they identified staffing issues. They also identified that it wasn't only in the neonatal unit there were problems, there was also an increase in stillbirths. And subsequently, in February 25, we get this report, which is this, it's an iconic report in relation to this case. It is hopefully a game-changing report undertaken by 14 independent, world-respected neonatologists who went through all of the cases that were brought forward by the prosecution. So there were 17 cases in all, went through all of those cases meticulously and found that there was no evidence of any malfeasance, there was no evidence of murder, there was no evidence of attempted murder, and the deaths, in fact, were due to natural causes, i.e. complications of prematurity, complications of infection, and also poor medical care. And in fact, the chairperson of that panel of experts said, if this was a hospital in Canada and he was a former professor of pediatrics in Toronto, said that the hospital would be closed down. So this was a hospital that was under enormous pressure, where things like this were perhaps more likely to happen, given the circumstances they were under. But you wouldn't want to think that that was the only hospital where this is happening, because over the last kind of significant period of time, over the last number of years, and also recently, there have been kind of reports coming out of the UK in relation to substandard care in maternity and neonatal services like Morecambe Bay, Telford, Leeds, Northwick Park, and more recently Nottingham. These have all been big scandals. So what was happening in this hospital was not necessarily out of context in the bigger picture in relation to medical care of mothers and babies. So these cases emerge in a particular context. They didn't emerge in isolation. And what was considered
we have more than one problem. Then we have obviously the problems of pushing so many babies into a system that isn't fit for them.
Yeah.
But we also have the terrible scandal of that this woman, that somehow within this hospital they found a woman to blame, and they found enough evidence to convict her of the most serious crimes possible, and it turns out she may be innocent. What evidence did they have? What evidence did they use?
Well, the evidence was, there was circumstantial evidence, and then there was scientific
Only
evidence.
circumstantial evidence.
Circumstantial evidence. No witness evidence.
Nobody saw her do anything.
Nobody saw her do anything. Okay, and there was also scientific or medical evidence brought forward, which has been dismissed by authorities in relation to this. And if those experts had been available in court, this would not have resulted in in a guilty verdict for Lucy Letby. I'm no doubt in relation to that. But let's look at the circumstantial evidence. So I suppose this was a circumstance where consultants began to feel that what was going wrong on their unit wasn't a systematic problem, that this was a problem that related to an individual. Okay,
So they thought that they weren't at fault, that something else must be at fault.
they thought either they or the system. Now, also it is reported that not alone were the pediatricians not specialised in neonatal medicine, apart from one person who had some special interest training, but also that the number of rounds done, on babies in the unit were few and far between. So, like maybe 2 rounds a week. Now, these are babies that should be rounded on twice a day. So you have a unit where it's not very well resourced, not resourced at all in relation to neonatal expertise, where also the next tier of junior doctors are not necessarily experienced in this at all, where you have a dearth of staff in general, and rather than looking at those issues, began to focus on one individual. And I suppose what happened was then that there was, the police were kind of notified in relation to this, that there may have been criminal malfeasance in relation to what was happening in the hospital. And as part of the investigation, a roster was produced whereby staff in the unit were plotted against incidents, unexplained collapses and unexpected deaths in the unit. Also, there was the involvement of an expert witness. The expert witness, who's the chief medical expert witness for this particular case, was a retired paediatrician. He was not a neonatologist. He had no special training in neonatal medicine. And he was at home reading the Guardian newspaper. And this is, documented by himself in a recent Netflix documentary. And he saw that there was an investigation commencing in relation to criminal activity in a hospital. And being a paediatrician, he felt that he also had a lot of experience of being an expert witness in court. So he volunteered his services to the investigation and said that this is something that he could become involved in. And he became involved in, I suppose, the initial police investigation, and then became the prime independent witness for the prosecution. But there was he looked at, I think, about 32 cases to start with of what they considered to be unexpected or unexplained collapses and deaths in the neonatal unit over a period of time. And then they narrowed it down to 25. And then they plotted 25 against, I think it was 39 members of staff, to see where the intersection of that, where the commonality would be. And that graph, which has been shown by statisticians to have no statistical value, because it basically put Lucy Letby kind of in the frame for this. And this is known by statisticians as the Texas sharpshooter fallacy. So in other words, somebody with a rifle goes out to the gable end of a barn and randomly shoots at the barn in a kind of a scattergun fashion, and then goes to the barn and takes out a piece of chalk and then draws a circle around a cluster of bullet holes and says, "I'm a sharpshooter. That's where I was aiming at." So basically creating a pattern artificially from a random dispersal of facts.
Which reminds me, in that New Yorker article, I saw that in one case, she had just arrived, she was counted in for a shift where a baby had died, where she had actually just walked into the room. The baby was in trouble. There was a nurse standing over it. She came over to help. The baby died a few minutes later. She was included in that when she obviously couldn't have been. But even, of course, we're like the sharpshooter. We're assuming that that's where the circle was, because this assumes that there was foul play. If there was no foul play, this is all just made up fictitious stuff.
Well, yes, exactly. So proximity to the event, without like anybody seeing her, without any motivation, without her having any psychological background that would lead her to do such a thing. It was assumed that she was the person who was guilty. Now, around the same, and there are overlapping events and timescales, but before she was actually charged with these cases, she did actually, because of the fact that two consultants in particular out of four who were very strongly pointing a finger in her direction, she took a kind of made a formal complaint about them in relation to bullying, and that she's been scapegoated in relation to what's happening in the unit. And an internal investigation did actually uphold that allegation by her that this was happening. And around the same time as, and I say the timescales are overlapping, but there was this report by the Royal College of Pathologists that came in November looking at cases, and it didn't emerge in their understanding that anything like this was happening. And also the babies that died, those that had postmortems, none of these suspicions were actually raised by any pathologist kind of doing a postmortem on a baby that had died. But anyway, Lucy Letby was put in the frame, and the expert witness who had been part of the investigation became a central player in the prosecution's case, and there's a certain conflict of interest in this. In somebody if you are appointed as an independent witness, expert witness, you're independent of either side. You're not on the side of the defence. You're not on the side of the prosecution. Although your services may be solicited by those,
he made himself available to the prosecution.
First of all, he made himself available. Secondly, he was part of the investigation, and thirdly, then he became part of the. He became the main player in the prosecution's case. He also.
So who then, or how many expert witnesses were appeared on behalf of the defence?
Well, there was no medical expert witness on behalf of the defence, which is none. And I it is hard to second guess why that was the case, because you had consultants from the hospital who were lined up to give their evidence. You also had the main prosecution witness, whom I might add had retired in 2009. So if you take it that this case is beginning, in November 2022, he's a long time retired. The second thing is he was off the medical register for 2 years prior to. He was off the medical register for a number of years prior to actually volunteering his services. And for the first 2 years of the investigation, he wasn't even a registered doctor. So it was a bizarre choice of person to have as a chief prosecution witness. But the defence, because of the fact that they felt that the evidence was weak, it was circumstantial, they offered no medical defence. In fact, the hospital had, and this is, probably implicated or has been implicated in the causation of the deaths, had a very poor plumbing system, kind of a low water pressure in the hospital. There was repeated contamination of sinks with sewage material, and they called a plumber on the side of the defence, but no medical expertise. Also, which as an obstetrician, it is quite remarkable that the maternity notes were dismissed by the prosecution as being of any value, and the maternity notes were not made available to the defence. And it was considered that the background, the maternity background, the pregnancy, the labour, the delivery of these babies. So if you take the 7 babies that were killed, 6 of the 7 were premature, 3 were under 3 pounds, and in the totality of the babies, both in which a murder was committed, or in which she was found guilty of murder and attempted murder, like there were babies down to gestations of 23 and 25 weeks. There was a set of identical triplets. These are really high-risk pregnancies. There's a woman who had a really significant complication of pregnancy. She had a condition called antiphospholipid syndrome. We had babies where their condition prior to delivery put them in an extremely vulnerable position in terms of their outcome. We had a woman, and this is well kind of documented in the Netflix program, a woman in labour for a prolonged period of time where her membranes are ruptured, where she is begging to have a caesarean section because she's making no progress. When the baby is delivered and goes to the baby unit, but she has no kind of grave concerns about the baby. And the next thing she knows, she's been wheeled up to the baby because it is in a really poor condition. She witnesses the baby being resuscitated and the baby dies. This is a baby where the mother should have had antibiotics in labour because she had prolonged rupture of membranes. She didn't get antibiotics. And this is a baby that was at high risk of infection and should have got antibiotics, and got antibiotics when it was too late. But there are numerous examples of vulnerability in maternity notes, which were not even looked at. Like, it is like every medical student, every midwife, every junior trainee in obstetrics and gynecology, every consultant paediatrician neonatologist must know that the condition of a baby at the time of delivery or shortly afterwards depends on what happened in the pregnancy, the labour and the delivery. And just to leave that out, it is hard to believe that in this day and age that such a gross omission could have actually happened, but it did happen. The other thing is there was no statistician. So we mentioned the Texas sharpshooter fallacy. So and in 2022, and this was around the time of the trial of the second trial, the Royal Statistical Society published a paper on serial healthcare killer or coincidence, right? And they cited, I suppose, the outcome of two previous cases, the De Burke case, which was a Dutch healthcare worker, and also the Pogliali case, an Italian nurse, both found guilty of poisoning, patients, where a subsequent statistical re-evaluation, a professional statistical evaluation of what actually happened, actually result in their convictions being overturned. So no statistician. The pathologists who had done pathology reports on the babies that had died were not called for cross-examination. There was no microbiologist called in relation to this contamination that was happening in the hospital. So, and one of the things that, in terms of my reading and of how juries behave, juries are more likely to be swayed when there is a convincing narrative. And the prosecution put forward a very convincing narrative. First of all, that what happened to these babies was not expected. That was wrong. These babies were vulnerable babies. They were fragile babies. Things were more likely to happen to them. That seemed not to be recognised. The second thing was that they could account for why the babies died. So when no counter argument, no scientific argument, no medical argument was brought forward by the prosecution. So it is not unreasonable that the jury, bewildered by the amount of information they were being given, a very strong narrative, also the appearance of the woman in court. So Lucy Letby at this stage had been in prison for quite a period of time between her arrest in 2000 and the trial in 22-23. So she'd been in prison. She'd also changed prison. She had been interviewed by the police on 30 occasions, and she'd been arrested on 3 occasions. She was suffering from PTSD. This was a woman who was under severe duress, severe psychological pressure, clinically depressed, and this was, I suppose, misinterpreted as that kind of Myra Hindley dispassionate evil look.
I saw this thing where one news report where they said that the police had conducted a search of her house and found a note that said, "I'm so sorry that she had," and they'd proved that this had been written with her own hand, and they'd also said that, by the way, she had seen a therapist who had said to her to write down some things if it helped her work out some things. But "I'm so sorry" doesn't mean anything. It isn't "I killed 7 babies." It's just "I'm so sorry that my tea is cold." It could be anything.
No,
And
she don't.
they had this thing about her saying, "Look at her. She knows she did it. She's very bad." And they were, why did they come on this woman so hard?
Well, in fact, Terence, it was more dramatic in that because she had she had basically a lot of self-confessional notes written in relation to "I am evil, I did this," basically confessional notes in relation to the what happened in the unit, and also, but there were ambivalent notes because she also had notes that "I'm very sorry for letting people down," "victimize," "slander." So there were notes that could be misinterpreted as an admission of guilt. But these were notes that were written when she was undergoing counselling. It was written after she was being called the angel of death by one of the consultants in the unit. It was written, as I say, under advice from a counsellor, and healthcare professionals, when things go wrong, and if a baby dies, and particularly, like a baby, and, like I know from my own experience as an obstetrician and seeing how obstetricians, midwives, neonatal nurses respond, pediatricians, neonatologists, to the death of a baby or a child, when you look back on it, like, am I responsible for this? You internalize I suppose the trauma of it, and one can blame oneself for it. Like, I'm responsible for this, and so there's a perfectly logical, reasonable, psychological explanation why she did this. But taken in isolation, and like if you see something like "I am evil, I did this, I killed the babies," that is not an admission of guilt. I suppose the other thing is in terms of what was found in her house. So they also found handover sheets. So these are computerized handover sheets, which basically wards generate in relation to the identities of patients on the ward and their underlying conditions. So most wards in Ireland will have them, intensive care units, so that when a doctor or a nurse is actually on duty, they have a list of patients. It's a printout. It's available through the computer. It's a confidential document with the names, identities, and diagnoses of the patients in the ward or the unit at the particular time. And she had, the way it was portrayed is she had taken ward notes home that related to babies, like serial killers actually take trophies. In fact, what she had taken was, this is a misdemeanor. It shouldn't happen. You shouldn't walk out of the hospital with any confidential information. She had. And what happens is that sometimes people put them in their pockets, in their scrubs. They go home, they find them. They're supposed to be kept in the hospital, supposed to be confidentially shredded. She took them home. She had an accumulation of them. They weren't disposed of in any non-confidential manner, but they shouldn't have been at home. But the vast majority of them actually related to patients and days where none of these babies were actually involved, and not all of the babies that were actually cited in the case were in fact in any of the lists that were there. So in fact, this was, I suppose, this was slipshod, and inappropriate to take home information. And I would wonder in a hospital such as this, like, what, given the standards that we saw of practice, what were the protocols in relation to documents? What was the like? Was it were staff constantly vigilant in relation to taking home material? These were not charts, but taking home any material whereby a patient could be identified in terms of breach of confidentiality, etc. I would imagine that that given the number that she had, that probably practice was unfortunately slipshod. But in no way are these trophies that relate to a serial killer whatsoever.
Chris, can I ask you a simple question? And I'm going to put you in a spot here now. Do you think there's any doubt, not about her guilt, but do you think there's any doubt about her innocence?
No, I would not have any doubt about her innocence because no crime was committed.
Oh
whatsoever. So basically the theories advanced, the methodology advanced in relation to how the babies were killed or how murder was attempted was that air was injected into their circulation, that air was injected into their stomachs, expanding their stomachs, some tiny stomachs, putting pressure on their internal organs, putting pressure on their lungs, their ventilation systems. An endotracheal tube was purposely dislodged so a baby on a ventilator was not being adequately oxygenated. Direct trauma to the baby, putting a nasogastric tube down the baby's into the baby's stomach in a traumatic fashion, overfeeding the babies with milk so that would cause again pressure on organs. None of these. So that independent panel of experts looked at those. They found different things. Another accusation was that she gave insulin to patients, to two babies, that lowered their blood sugars to profoundly low levels. No evidence that any of these things happened. In relation to the insulin, a total misunderstanding of the pathophysiology of how insulin and a related chemical called C-peptide and glucose actually behave in small babies. The absence of any robust laboratory measurement of what they were basically using to accuse this woman of having given babies insulin, that nobody saw her, and that she would actually have to put it into an infusion fluid that another nurse would have had to pick out and actually given to the baby. Like the independent panel of experts found explicable causes. So babies that were very premature, babies that had growth retardation, babies that had low glucose due to prematurity, due to infection, due to growth retardation, due to the fact that the drip that they had to give them to give them glucose when their sugars were very low had actually tissued, and that had not been responded to. The fact that babies did not get antibiotics in time, so there were babies who had chest infections, there are babies who had premature lung disease, a patient had a big hematoma in their liver, maybe, or not most likely caused by a traumatic delivery of a premature triplet baby. They found logical arguments, logical reasons why these babies were killed. So unlike the Birmingham 6, and there are analogies with the Birmingham 6 and with the Guildford 4, like for anyone particularly from this country in terms of a miscarriage of justice, unlike those two cases, there was no crime in this case, but there is a very significant, egregious miscarriage of justice.
Can you? I don't know how close you're involved with the campaign with Lucy Letby, Chris, but can you tell me how is she doing? Does she have any chance of getting out? Does she have any chance of a retrial? What's the situation with her legal case?
Well, the case now is with the criminal. So there were two appeals of the case which were rejected, and she has a new legal team and a new barrister, Mark MacDonald, who has been very kind of proactive in advancing this case. So it's prior to the Birmingham 6 Guildford 4, like if appeal was rejected, what happened was then the final court of appeal was actually to go to the Home Secretary. And in those circumstances, this Home Secretary, obviously with independent legal advice, quashed cases that were unsound. They were not retried. They were quashed. To distance the political establishment from making kind of quasi-judicial judgments, these cases now go to the court, the Criminal Cases Review Commission. And that's where the case has been there now for quite a period of time. And it is likely that the response, like the best response, I think that they will give is that they won't quash the conviction, but they will send the case back for retrial. I have no doubt whatsoever, given the amount of statistical, given the amount of medical scientific evidence, that if this case goes back to retrial, that first of all they will find it very difficult to get expert witnesses to actually counteract the arguments that the defence will bring forward on this occasion, and secondly that she will be found not guilty. And by not guilty in this case, I would mean that she's actually innocent, because actually no crimes have been committed. She has a number of, I suppose, people who've championed her cause, and they come from maybe unexpected places. Like, I never thought I would agree with anything David Davis would say, who was the Brexit minister. And he has been, once that Rachel Aviv case paper was published in the New Yorker, although the second trial was, I think, underway at that time, so there were restrictions on reporting, he did actually use the House of Commons privilege to actually comment on it, yes, which I thought was a kind of a very courageous and noble thing to do. Jeremy Hunt, who was a former health secretary, was very to the forefront in saying, like, this case did not emerge in a vacuum. It is emerged in a context of scandals that are happening in the maternity and neonatal services. There are two recent reports, the Ockenden report on Nottingham and the Amos report on nationwide services, NHS services in relation to these services. And they describe the type of dysfunction that actually happened in the Countess of Chester Hospital. And I would think that Lucy Letby is a victim, just as the babies, children and mothers in these various hospitals have suffered. She too is a victim in a very different way. There is a book, I went over to London actually to the launch of a book by Christopher Morris, who's written a book called Reasonable Doubt, examining the case of Lucy Letby. And for anyone that's interested, it is a forensic examination of the trial, a forensic examination of the evidence, and I think no more than the book that Chris Mullen wrote on the Birmingham Six. I think it is probably a game changer in relation to bringing the case into the public forum. But like, there has been, and it's interesting also, Terence, that the publishers of the book are also the publishers of the book on the post office scandal. And I mentioned the medical context. There have also been a number of very significant convictions that were reversed. There's Andrew Malkinson, who served 17 years for rape, whose conviction was in fact overturned. Peter Sullivan, 38 years for murder. And I suppose the biggest scandal not involving murder was the post office scandal, where so many postmasters and mistresses kind of ended up having to go to court, lives destroyed, people went to jail, all over a systems problem, and also a failure of the criminal justice system. The stakes are very high in this case, Chris. I think that's one of the problems. You've got bereaved parents who, in fairness, have suffered tremendously, phenomenally, as a consequence of the death of their babies. They then subsequent, like any hospital investigations or information they got back at the time, then the thought that somebody could have killed their babies, then the proof, according to them and the prosecution, that somebody did kill their babies, and then I suppose the emerging narrative that in fact it's not that at all, it's something different. Like, you have to come to terms with so many different things. There's also the Thirlwell inquiry. This is an inquiry established to actually ascertain how Lucy Letby killed and attempted to murder all these babies. That's the starting premise. And the person in charge that has criticised any voices of dissent in relation to her guilt. And that inquiry has completed its work, but it has actually refused to release its report yet. There are also coroner's court inquests that have been delayed because the case is now in the CCRC. But I think the implications for the criminal justice system are quite profound in relation to how expert witnesses are chosen. The responsibility of judges to ensure that a trial is fair. Like, during the course of the trial, this judge was contacted by another judge to say that the evidence given by the chief expert witness in a previous case was extremely flawed, and he had concerns about the reliability of his expertise. Also, an email came into the court to say that one of the jurors was overheard to say that we made up our minds very early on in this case. I don't know how this judge kind of oversaw a case where the defence offered no material medical evidence and where he was aware of other information that was coming into him. So I think there are questions to be asked about also how a jury is supposed to respond to very technical information that is being given to them, and the responsibility of a judge to actually ensure that the trial is a balanced trial.
Yeah, I think that's one of the big things here in the case is I don't think the jury understood the science behind what they were being told, and they were only getting one side of it, the schedules and the likelihood of these things happening and so on. And they got such a bad picture, and then I suppose we're almost done, Chris, and we can certainly hope that Lucy is released soon, and that she somehow has the grace to recover from all of this, as the parents and everyone else involved. It seems just an absolute chaos and catastrophe situation. But I'd like to ask you, there's a final thing. Do we have something to learn from this case in Ireland, particularly with regard to maternity care?
Well, I think there are lessons to be learned in relation to small hospitals operating beyond their capacity, and also the knee-jerk responses to clusters of events that take place, finger-pointing exercises, scapegoating exercises. I think there are lessons to be learned by the medical profession. There are lessons to be learned by the media. And I think the media were basically castigated this woman around the time of her conviction in particular, but also you'd have to give them credit for the fact that it's the work of journalists, significant work of journalists, that has actually resulted in the case kind of getting as far as it is at the present time in relation to re-examination. I think there are lessons for the criminal justice system and also for medical negligence lawyers in relation to how expert witnesses are chosen. How independent are they when they are actually basically employed by one or either side? And there have been arguments made that the court should appoint the expert witnesses. So their responsibility is actually to the court, which it is, not to the side that actually is their paymaster. I would have one final appeal, Terence. So there is a duty of care and, of open disclosure for all doctors. And for doctors that are expert witnesses, in fact, for all expert witnesses, there is a duty of candour and disclosure, and a continuing duty to the court that, if given the volume of evidence that has emerged since the convictions, the scientific evidence, the statistical evidence, that I would appeal to those expert witnesses who actually gave evidence in the trial 3 years after her first conviction, which is in August 23, to perhaps reflect on their judgment at the time, which I would assume absolutely was given, whatever we think about it now, was given with the best intention and honestly, that they would reflect on the evidence as it emerged, and they have a legal and a professional responsibility actually to inform the appropriate authorities if on reflection they feel that their opinion was in fact incorrect. And I think if they look back on it, I think that some or many may see that what they said at the time does not actually stack up now.
Brilliant. Well, thank you, Chris. You've been listening to myself, Terence Cosgrave, and Professor Chris Fitzpatrick talking about the Lucy Letby case. And the book is called Reasonable Doubt by
Christopher Morris.
By a man called Christopher Morris. You can look that up if you're further interested. This is the Irish Medical Times podcast. We'll see you next time round. Thank you.